And then we'll start with some introductions. Renee, would you mind introducing yourself to the group?
Sure. Renee Bolio Banks, Indigenous Cause, Shaganashimong, Zibiquen Indigenous Cause, Jagazaswa, Jamaica, Ndunjaba, Migizin and Dudame. So my birth name is Renee Bolio Banks. My spirit name is River Woman. I'm from Leech Lake Nation, and I'm from the Eagle Clan. I've been at NACC for over 4 years, and I'm the elder in residence, and I absolutely love my job. So welcome, everybody. Thank you. Miigwech.
And Dr. Rabi?
Hi, my name is Kari Rabi. I'm the family practice and addiction medicine physician here at NACC, and I have been working with the MAT program since 2016.
Thank you. And Nikki?
And I'm Nikki Jardina. I'm the infectious disease nurse at NACC and previously did MAT nursing here, and I've been here off and on since 2016.
And I'm Lindsay Kinkuni. I'm the community and tribal engagement specialist at NACC, also from the Boys Fork Band of Ojibwe. And let's see, I'll do some announcements. Share my screen. Okay, so welcome to the Midwest Tribal Echo. This is the Opioid Use Disorder Education and Treatment Series. And today I'm happy to welcome Dee from SWOP Minneapolis, and she'll be talking to us about sex work affirming care. So we are the Native American Community Clinic. We're an FQHC that was founded in 2003. This is a list of current open positions at NACC, so feel free at the bottom there's our website. You can read more about those. Please know protected health information today. If you could mute yourself if you're not speaking. If you're open to turning on your camera, we'd love to see your faces. We have a new Echo platform. It's called iEcho that we're going to be switching to. So you'll need to sign up for that. I can put the link in the chat. So to watch the echoes moving forward, you'll have to sign up. Some next echoes coming up. So December 6th, we have Transitions Clinic Network. And then December 20th, we will not have an echo due to the holiday. And then this is a list of other echoes that we recommend that cover similar topics. We do offer CME credit for these sessions. You just have to fill out the post-evaluation survey to receive the credit, which I can put in the chat as well. And then the credit does go towards the training for buprenorphine prescribing. And then if you do have any case presentations, feel free to share those with us. We'd love to. We haven't done a case presentation in a long time, so yeah, feel free to share. Whoops. And then I'm going to stop sharing and hand it over to Dee. All right.
Okay. Hello. So does that look normal? It looks good. Okay. So my name is Dee. I am from SWOP Minneapolis. We are a local chapter of a larger national organization. SWOP stands for Sex Worker Outreach Project. There's a lot of little pockets of us all throughout the country. We've been organizing in Minneapolis for about 8 years. I've been doing this work for pushing on to about like my 4th year. I think I'm in my 4th year of doing sex work organizing. What I'm going to be sharing with you today is about, thank you for the introductions and the blessing too beforehand. This will be a little bit of like a combination of some things. So I have some objectives and like the discussions that we can pull out of this presentation. is we will be talking about what sex work is and what it is not, who works in commercial sex, that's a typo, who works in commercial sex work and why, sex work affirming practices, a little bit on whorephobia, stigma, and bias, healthcare needs that are specific to sex workers and the barriers to access that exist. We will be talking about kind of like how we need our rights, not rescue. We'll move into decriminalization as a public health issue, and we also have some legal frameworks that we can go through. Any questions so far? So feel free to ask questions in the chat box. I don't mind being interrupted or slowed down to be like, can we go back to something? I can jump around. So feel free to definitely chime in with those things. And I'm pretty sure we will have plenty of time at the end to do some more conversations and questions. So you can wait until the end as well. All right, so who are sex workers? So sex workers are adults who trade erotic labor for money or other things they might find of value. And what might be of value could be very different for everyone. Some of those things could be housing, it could be childcare, food, substances, plethora of options of what could be of value. Sex workers are workers who consent to their labor. They do not exist in any form of a monolith, from the work that they do to the kinds of people that they are, any gender, race, class, sexual orientation, education level, religion, or background. And all of these people enter the sex industry for a plethora of reasons, and it can be for short-term or long-term, and it can be in a full-time capacity where that's the only thing that they do, and it could be something that they don't do very often on a part-time basis. Sex workers are parents, students, and definitely some of your patients. And they're definitely somebody's best friend as well. So we want to treat them with dignity and care, just like we would treat how we want our best friends to be treated. So what does sex work look like? It could be indoors or outdoors. And when we talk about legal models, that's actually something that really comes into play with the law, because there are different risks and safety needs for these different types of environments of doing the work in. In a lot of places, it's kind of like indoor is a very different world than like the outdoor world. So we have people who are working and getting clients and doing everything like the job outside, and then there's people who might be doing exchange virtually with people, and then they are doing like meeting in a hotel or an actual place that has walls. So it can be in person or virtual, local, long distance. These can be like, not all sex workers are having like P&V sex even. There's many types of sex work where there is no physical contact whatsoever. And then there are some where there is definite contact with fluid exchange and things like that. So types of work would include full service. We have BDSM work, erotic healers, strippers, body workers and erotic massage type of work, porn performers, companions, intimacy consultants, phone line workers. All could be different types of work that people engage in. People enter sex work for any reason that anybody would get any job. For financial security, because we are living under capitalism. Sex work actually offers a level of autonomy and independence that traditional employment might not allow some vulnerable people. There is flexibility around parenting, school schedules, and other life obligations. The work itself is actually more accessible to disabled sex workers, and it needs to be accessible for them because of how inaccessible conventional forms of employment typically are. Those other barriers to employment, which could be, you might not have a social security number, you might not have a safe way to get your information on record because of a domestic abuse situation, or you like, there's just so many safety reasons and legal reasons that there are these barriers to employment. And really, there could be any other reason, and there doesn't even have to be a reason. People just enter this industry for their own personal choices. And it's definitely best to just understand that kind of, we're not going to pathologize why somebody gets into this work. And so affirming practice is kind of just a buffer, and each of these could really be a huge conversation. Harm reduction things that are really particular to sex workers are like the safer sex and drug using education and supplies, making sure that we have access to those tools. And we know how to actually use them. When we do our street outreach, it's really interesting, like how sex workers are able to take care of themselves as well. And so it's also, when we do street outreach, there's like so many networks of people who are kind of helping each other through just one place. So like, and so if they can get that kind of care from a clinic, it's almost like we see that knowledge kind of like spread through the community in a way. Understanding the barriers to the sex worker community, which includes like access. Sex workers could have strange schedules compared to the conventional worker. Our work is criminalized in a multitude of different ways, and that could stop us from wanting to come and see a doctor. And even if we get through that and we get into the place to see somebody for our health care, the fear of stigma could even keep us from actually being fully honest or being in a space where we are getting the care that we need, because we may not be able to feel like we can self-advocate for ourselves while we're being judged under the stigma. The needs of the community we're going to expand on this in another slide, but they range from physical, mental, emotional, social, and spiritual needs. We have to include all of those for the whole person. Just some visual affirmations like sexual or sex worker centered literature and info posters and art can be really helpful for sex workers. Using affirming language, specifically using the language that they use to self-identify with, is usually safe. And it's always really important to do some bias unpacking before we do the practicing of care, which is really addressing the internalized whorephobia that we might carry with us, and also kind of acknowledge the whorephobia that is in the system around us as well. And that whorephobia that kind of builds all of this, I don't know, these barriers to getting what we need, and kind of creates this stigma. And one thing that I've seen that I really like how it's defined, there's lots of different ways to talk about whorephobia, but it's really ultimately the rejection and aversion to sex workers, and it's an institutional violence and harm. And so it's very systemic, but we also kind of have these systems in our own selves and in our bodies. And that might look like, on the institutional level, it would look like banking accounts closed, or not having any access to your money. Stigmatized care, which would be like pathologizing why you might be there, or blaming the problems around sex work, trying to get that person away from sex work, which could be even more damaging to how they are being able to take care of themselves. Often people see sex workers being unfit parents. They are not reporting violence, and they go uncategorized because of their job. So even if they are reporting violence, it's not being properly handled because the job is stigmatized. There can be housing rejection, and specifically in the city of Minneapolis, there is even I think there's an addendum to everybody who signs a lease. I think in the city of Minneapolis has an addendum to sign where they kind of promise to not harbor or use the space for prostitution. And so that's a very big thing that could get you, if you have a prostitution charge or you get caught doing sex work, there's a chance of being evicted or not even having a chance to get into housing. And there's also survivor blaming, which is kind of not taking the account of the violence that is actually placed on the person and instead blaming them for what happened to them instead of seeing it as a violent thing. So stereotypes and biases. So we just want to take the intentional time to reflect on like our own thoughts about where our thoughts about sex work came from. And we can kind of look at it, see it for what it is, and relearn and build some new blueprints and frameworks of understanding from resources that are created by people with lived experience, which is exactly what you're doing when you do these kinds of workshops, which is really great because you're hiring a sex worker rights organization for consultation right now, and that's awesome. And so just some things that are really common about like this kind of monolith that sex workers are put in that isn't really accurate. And so a few of the common misconceptions that definitely impact the health care setting are all sex workers are drug users and addicts. All sex workers have STDs and STIs. All sex workers are victims of abuse. That's a big one. In a lot of our places too is like, we don't want people who, like, there's a power dynamic here where the state and sometimes clinics, like, we don't get to define what a victim is. Like, that's for the person, like that's for a survivor to define for themselves. We can't put a stamp on it, somebody who doesn't claim that, who doesn't feel like they are a victim of something. And that happens a lot. All sex workers abuse alcohol and cigarettes. Most sex workers won't get screened or tested, which has been actually very untrue. And that has been like empirically studied before. Sex workers must be coerced or forced to do this kind of work. Definitely not true. People choose this work all the time. And all sex workers are cis women, which is not true. There's lots of men and non-binary trans people. Like, everybody does sex work. And snap judgments like the ones that we just kind of talked about, that's like kind of the stuff that prevent workers from getting the medical treatment that they want. And it kind of halters sex workers to be able to self-advocate for themselves. So the big barriers, kind of already talked about them, but we're going to go through them. So the criminality, just the basic fear of arrest for seeking care, that mandated reporting power dynamic is very real. And so being sure that we are not deciding things and deciding what is safe and not safe for people who are not asking for that. Privacy, fear of being outed, and that can just be a safety thing as well. Judgment and pathologizing. Sex work is work. It's not to be pathologized. The healthcare worker bias is kind of at every level. It's from when that person starts to make the appointment. They're thinking about they need to see a doctor, and then being able to actually get there. There's a lot of people and a lot of steps that have to happen. And everywhere through that process, there's tons of opportunities to make sure that sex workers are feeling included and cared for in their dignity. Judgments around sexuality, inadequate comprehensive sex education and consent education, how sex work is portrayed in the media are just a few things that build these layers of rejection around sex work, but we can absolutely dismantle those for ourselves in the way that we approach care. So just some notes on some language. So we want to use that language that somebody uses to self-identify, including their name and pronouns. We don't want to use words like prostitute or prostitution because these are criminalized words. These belong in statutes. These are like the courtroom. These are legal words, not like identity words that are affirming to a person's person. Kind of the typical ones to avoid are hooker, prostitute, lady of the night, streetwalker, sugar baby, whore. A lot of people are proud of the word whore and use it often. It's the gigolo, John, trick, Vic, pimp, working girls. These are things that we might see people from like inside the community work, like to speak about ourselves. But from the outside and definitely in the healthcare, like what we're seeing now is we're seeing really good sex worker affirming language in the media right now. Like we are seeing, like specifically even in Minneapolis, like all of our news outlets are using the word sex worker when things are being written, which is really great. But yeah, these are sex workers, these are providers of a service, and they have clients. So we need rights. We don't need to be rescued or saved from the work that we do. Sex workers are people full of capacity and self-competence, and we have the right to privacy, dignity, respect, affirming care without judgment, and access to the wonderful care that we need. And those needs might look like what everybody else needs. But unlike non-sex working people, we are at risk for judgment, stigma, and pathologizing when seeking healthcare. So the specifics on the sexual health is sex workers actually do practice safer sex at higher rates than non-sex working people. The reason that there is an increased risk of HIV, STIs, and pregnancy is because of criminalization. People know that they can harm sex workers and abuse and hurt them because they know that they can get away with it. Sex workers also deal with chronic pain. Sex work can be strenuous on the body, joints, and muscles with repetitive movements. It takes a lot of muscle work, I know too, to like do the performances that strippers are doing. Emotional and mental health. Sex workers perform emotional labor, and the burnout rates are just as high as any other service industry or care work job would show. Social stigma and needing to live a double life can also be very physically, socially, and spiritually stressful in somebody's life. We only need to collect information necessary to perform the care that's relevant for their concerns that they came in with, and we can avoid pathologizing someone's work as the cause of an illness. This is kind of the same information, just laid out a little bit differently. And now we'll go on to like our rights. So every major human rights organization supports decriminalization in the fullest realization. And as a provider practicing medicine in the community, I think it's kind of important to understand how the decriminalization conversation is definitely a public health one. So the ACLU says that the criminalization of sex work makes sex workers more vulnerable to violence on the job and less likely to report that violence. It prevents sex workers from accessing healthcare and other critical services, and specifically for society's most vulnerable groups, such as trans women of color and immigrants. The Human Rights Watch supports the full decriminalization of consensual sex work. It would maximize the workers' legal protection and their ability to exercise key rights, including justice and healthcare. Legal recognition of their occupation would maximize protection, dignity, and equality. And there is also some really interesting data that, so like according to this one study, decriminalizing sex work could avert between 33 to 46% of HIV infections among sex workers and their clients over 10 years, which is massive. So criminalization has been proven to impede access to healthcare services. And there's also a lot of work right now around this STI, and this isn't included in the slide, it's just information that I happen to have, is the like the medication resistant STIs as well, and how that goes into the into the sex working arena too, and how that access to make sure that we have protection from violence, and when we need that healthcare, we actually can get it, is a major part of just having some decrease in the spread of disease overall. The World Health Organization absolutely recognizes that sex workers face high levels of stigma and criminalization almost everywhere, and that reduction it would come with, oh, I'm so sorry. Yeah, so the 46% reduction in HIV infections over 10 years, and while eliminating the sexual violence against sex workers could be at a 20% as well. So there's like all these really great decreases of things that come at it from a public health perspective too. So now the legal models. So criminalization is the most carceral option, and it is the most dangerous. So having any type of interaction with police are actually a lot of our abusers. So that is never in like, and then getting into the violent state system as well is not good for, it's not good for anybody. So on the complete opposite end of, I guess, in this like this legal model where there's government surveillance here, we have the legalization which is still stigmatized because of the regulations and surveillance. It really limits the accessibility to the people who really need to have this access to this work. And the legalization is also a form of, so it's a form of state regulation, and it also doesn't necessarily put that much power in the worker. It just puts more power in the state to decide what that looks like. And I guarantee you what the state decides and what the worker thinks as safety are going to be two different things. There's also something kind of in between where we have some parts of sex work that are legal and some parts that are not legal. And so we have partial decriminalization, also known as end demand models. And these are frameworks that punish the buyer, and they have unintended consequences in that although the worker is not being charged with a crime, the buyer now suddenly has a lot more power over it because they're the ones who claim that they have risk. And so it's actually putting this strange power dynamic into the worker buyer situation that doesn't actually benefit the worker at all. And it's criminalizing the people who hire sex workers. So it's just the unintended consequences are not there. The goal of that is to end sex work. There's not really any goals around end demand models on protecting the rights of the worker. It's kind of to get rid of the job category altogether. And we just know that that's going to be that's going to be impossible. So there's this decriminalization option, which is in its full realization. It means that nobody will be charged with a crime for having consensual sex, regardless if there is an exchange of value or not. And this would allow for full agency and access to legal, health, and working rights. So the state wouldn't have anything to do with it. It's just totally not a crime. And this is kind of a fuzzy little graphic. But so legal sex work provides helpful standards and benefits, but only to the most privileged of workers. It would be regulated and controlled by the government, making it inaccessible to immigrants and intersectionally criminalized people. Legalization does nothing to address white supremacist violence and encourages workplace discrimination. That carceral framework really targets sex workers as victims, but we actually are victims of then the state and gendered violence and incarceration, deportation, harassment, and stigma. And currently right now in Minnesota, a third prostitution charge is a felony, and condoms are being used as evidence, but we're not seeing it. It's just definitely they're not being used as evidence in court cases like we're seeing, but they are definitely being used for police to harass and getting the police to have further contact with workers. This is a little flyer that I made up, and I'm just going to spin by it. I can send this to you and get this little pamphlet for you. It has a little bit about, in Minnesota, we have the Safe Harbor Project, and that's an example of that end demand. So we don't criminalize folks under 24 or under for prostitution. We just don't charge them for anything, but we do see them as a survivor of violence. So it fails to kind of give the autonomy in that way, where it's just kind of stamping this idea or this label on somebody. And it's not really doing anything to make sex work safer, and it actually further marginalizes people. So what can you do for further? Actually, I'm going to check something. Yeah. So there's lots of books and articles and research written by people with lived experience. I can get you lists of that if that's something that you're interested in. We can learn and familiarize ourselves with the legal risks that sex workers face by getting really intimate with our local landscape, following us on Instagram, maybe coming to some public things that we do. Practice compassionate listening around things that you are brand new to and learning about, trying to relearn about, and openly support movements that focus on preventing violence in sex work. All right, I just did so much talking. I think that's the end of it. We can open it up to questions. I see the chat's going.
I have a quick question. Would you talk a little bit more about the difference between decriminalization and legalization. Just, and you may have already fully explained it and I just didn't totally catch it. So, and just, it sounds like what you're saying is that as opposed to legalization, decriminalization offers like more supports and stuff, but just curious to, yeah, hear more of that.
So, really great question, and it is a little confusing to wrap around. So, when I think of legalization, yes, it legalizes a little tiny area of it according to what the government wants. But if it doesn't fit into that legal framework, well, then you're going to be, it's a crime. So, like, it's still, the legal framework is actually still carceral. It's still criminalized.
Yeah. Mm-hmm.
Because you have to do it exactly how the state says. And it's very like where we do see that in other places of the world is the types of health screening and interrogation that the state places on workers is quite devastating.
Okay. Mm-hmm.
And it's forced health testing and it's mandated healthcare. I mean, it's not good. It's yeah.
And so although decriminalization, it sounds like a smaller step than legalization, like actually it has better outcomes because it doesn't give like the state the full ability to control all and like, you know, possess the revenue associated with it. It's like a middle ground between, it's like out of state almost then is kind of. Yeah, that's really interesting. Thank you.
Yeah, and it really takes away, I mean, what it really does is it takes away everything that would be stopping somebody from actually practicing the full agency as a worker, as any other worker.
Yeah.
Isn't it a further step though than legalization? Because it's not that it's still illegal, it's that it's just removed all definitions of the activity as illegal, right? So it's not that it's still.
No,
Yeah.
right.
It is actually less work. It is kind of interesting to think about. Like, it's less work. We're like removing something from this. We're not adding, we're not creating a new thing. It's really just, right. We're just going to stop and we're just going to let people have consensual sex because it's a constitutional right. But I mean, yeah.
Right. Fascinating. Thank you.
Absolutely.
It looks like I see a question in the chat from Lena. Lena, did you want to ask your question?
Oh, for sure. So thank you for this presentation. This was great. A lot of great stuff. So my question was, stealthing has been like a pretty big issue here with sex workers. And so I was wondering, what's the best advice for someone who has been like exposed to this type of violence, depending on, I think like cost has been a big issue. I know there's PEP, but I think accessibility, cost, and just not knowing what to do have been like the big things.
Absolutely. And that would be, stealthing. I mean, that is, I think having access to that immediate type of to that care around what, like, somebody who just had violence placed on them and harm placed on them and being compassionate in that regard. I'm not actually sure how to like properly. I know what I would do is I would just make sure that person knows that that was fucked and that was something that should not have happened to them, and that they could have possibly been exposed to something. And I would do STI education. I would ask them what they need, if there's any resources that they can think of that they would want. There's I think a lot of times the types of like, what I think of is like a lot of sex workers we are very good at boundary setting and communication. And I think having the support around like really building on people's agency in their own boundaries and safety can really bring in some more of that confidence and security after harm has been placed. I'm not sure if that's a very good answer, but my advice would be, let's get you into a health clinic that you feel safe to in the time frame that makes sense. Let's make sure you have all the tools and the things that you need. Let's make sure that your heart and body feel safe before you go to work next time. And let's come up with ideas on what conditions need to be present for that to happen.
Thank you so much.
We'll go from there. Yeah.
I had a question, just if you could expand kind of where we're at in Minnesota and in Minneapolis as far as the model.
Yeah. Okay. So I think I might have skipped a slide, to be honest.
I think I
So-
think I maybe saw that, and I think it was on the Minnesota law.
Let's see here. I'm gonna share. Okay. So we have in Minnesota, we have the safe harbor. So I kind of already talked about that. It is a version of end demand. There is actually, we do have a pretty good relationship with a lot of anti-trafficking orgs in the city, and that's been such a great movement for like just because coming together as anti-violence is like truly what I think everybody needs and wants at the end of the day on working together. So the safe harbor is very much an end demand anti-trafficking type of model. It's not very interested in protecting worker rights or making that work safer. It's kind of about making sure it doesn't go here. Right now, the third prostitution charge is a felony. We're not actually seeing a lot of people being charged with prostitution, but we are seeing people being approached because of prostitution and then end up being charged, like arrested for other things. So we know that sex workers are being arrested. They're just not being arrested for prostitution. And what the trends in the Twin Cities is typically looking like is we see a police force create an ad for services, and then so it's a sting operation where like no worker is actually being involved, like there's no survivor, there's no person, like there's no, like it's just the buyers are then meeting the cops and they're getting arrested right then and there. And those upset me personally, just because they kind of make it seem like they're really like taking these people off the streets and like, you know, look at all like the harm that we just prevented, when it was like, but you created it, like you designed that. So that is what we see more of than what we are seeing like big raids. Like those types of stings are more popular than raids. But we did actually just yesterday, and we're looking through this a lot right now. Like currently we're trying to like catch ourselves up on what the changes were, because in the last legislation, there has actually been some updates to the language of our labor exploitation statute. We are still very much conflating sex work and trafficking and exploitation in the legal language. And so there was even, I was going to share a different screen. This is just the list. So all of our laws are in the 609.3 type of area. We put these together. So you'll see prostitution and sex trafficking together. And so we're definitely conflating them. So these are viewed almost as like the same thing. So like prostitution is exploitation. They don't actually view the worker as a full agent of their body and choices. We have laws that go into then like the patrons, housing individuals who are engaged in prostitution. There's a law that like if you are knowingly harboring a sex worker, you can be charged with a crime. So there's a lot of third party crimes that are coming into here. Loitering with the intent to participate in prostitution, that's one that we would really love to see repealed, because that's just a quality of life crime that needs to get out of the books. Disorderly houses are basically just like the idea of like a bordello or a brothel, like just if you, and like they even affect, I think, sororities as well. So like if there's just like X amount of women living in the same house is like kind of an issue. But those disorderly houses, it's all about sex work. So it kind of exists everywhere. I don't know if that's super helpful, but that's what it looks like.
Oh, thank you for going over that.
Yeah.
There's another question in the chat from Meg. Is there a strong correlation between addiction and sex workers? And if so, would decriminalization reduce the rate of SUD possibly?
I think there could, yeah, we see it. Addiction and sex work often are two things that are experienced at the same time. There can be, that could be the way that that person obtains their substance, or just pays for it. They are coincided, and a lot of times they are like one or the other. I know, like they like just are two things that hold together. I wouldn't say, like, I think what's important there is to make sure that, again, that person has all of the access to the things that they need to be able to do both safely at the same time, because a lot of people will use drugs to cope with maybe the effects of their work. Drinking alcohol, maybe doing a line of something would make like showing up to their work easier for them to be able to pay for their childcare or for anything, right? So a lot of times those two things are very hand in hand, and they can be, and everybody's personal relationship between those are going to be very personal. It's going to be very different. And then the question was, would decriminalization, what was the question? Would it increase?
Would it reduce the rate of SUD?
Yeah, every study that we know about says that it would. There have been an instance, I believe it was Rhode Island, accidentally decriminalized indoor sex work for a period of time where we have been able to collect a lot of data, and gonorrhea was reported to be down by 40%. And it's directly linked to having the decriminalization framework placed into the indoor. And what people are also reporting is what's really big about it is the reporting of decrease of violence. The violence and STI risks, I think, are the most like interesting things to look at. Because once you decrease violence in this industry, you're going to see a decrease in the STI infection rate as well. So those two things are very linked. And the decriminalization would no longer create this playing field where violent people get to just harm sex workers and thinking that they'll get away with it. This is they do hurt sex workers because they can get away with it. Because yeah, that's just the way it is. So the more empowered people are to be able to be free of punishment, to come forward with not only violence, but just being able to have access to a clinic, those two things working together can would exponentially make a difference.
Hi, my name's Brenna. I'm up in Duluth, and I really liked your presentation. I have, I guess, two questions. One question, I'm interested in what your organization, what you see as the next movable pieces in Minnesota, in Minneapolis, and in greater Minnesota too, or Duluth, in terms of advocating for rights and better healthcare and stuff like that. So what are you organizing around? And then my other question is, around the different types of sex work, because there's a lot of online sex work too, and what you see as different harms or risks under the current system of criminalization for online versus kind of in-person types of sex work.
Absolutely. So locally, thanks for those questions. Locally, we work really well actually with the City of Minneapolis City Council. So we have a good relationship there with a few representatives who really advocate for us on our behalf. We are currently really looking at all of the ordinances, to specifically the quality of life ones, like that loitering. We wrote and published our decrim report this year, which is a little booklet. And we are currently in the process of giving that to all of the city council members. And now with the new election, I know we're going to have a new cycle here, but we're going to be looking at all of the little minute ways that the books have archaic language around sex work. So that anti-loitering is going to be a huge one for us. And like sex work is kind of like the anti-sex work language is kind of nestled everywhere. And it's a little intimidating to like look at it. But the loitering one is a big one. And the next step for us would be we want to get onto a county level with non-prosecution policy. We have a pretty progressive district attorney right now, Mary Moriarty, and we would love to be working on ways that that system can be like making sure that sex workers aren't being charged for consensual sex work. And then at the state level, it would be great to like kind of connect with some more folks like in the St. Cloud, Duluth, Rochester area and kind of get our ropes together and bring something to the state level that would kind of just be a blanket rewrite over. It's not necessarily kind of removing things more as it would be just to introduce a law that says everything that came before this that criminalizes sex work doesn't exist anymore. It would just be a blanket decrim bill. That's kind of our vision. And the things that we got our hands in right now. The second question. Oh shoot, I forgot the second question.
That's okay. Sorry. Thank you. That was helpful. The second one was just about like understanding more about kind of the risks that exist with online versus in-person sex work.
That's right. So there's a lot of privacy. So privacy is going to look very different for each of those workers for sure. I don't have that much knowledge on online safety, like personally for me, but I know that they're like the amount of tech knowledge that some of these people have is just like so impressive. Like making sure that their data on their actual computers are safe from being stolen, their identities and being outed. There can be stalkers and harassments. A lot of people who are doing online work, they don't actually have physical money exchange. It's really all through electronics. So there's a big financial vulnerability there that banks are just straight up taking away access to money. They just don't have their money anymore. So a lot of like inflex or insecurity and wishy-washiness with the money stuff. There is emotional violence, like although that physical harm thing might not be there, but there's still very much an emotional, spiritual type of vulnerability that can impact the physical body. And then the difference, so for in-person, I think there's like different screening. So workers will decide who they are. And that's one big thing about decriminalization too, is that workers are reporting huge numbers or like a bigger ability to be able to say no to clients. Like under criminalization, it kind of like, there's just that power dynamic again that I keep talking about, but being able to say no to potential work is really important, and that decrim landscape will do that. But the different ways of screening for online workers and in-person are going to be different in who they decide to work with and come in first contact with folks. And then even people who are working outdoors in person, their screening is going to be very different. They might be looking for different clues, like I don't know, like different clues about like a person in like a car that they might be driving versus somebody who has the access to do like a full background check on their clients beforehand. And that's just is going to look different from that person's individual screening requirements, I suppose, and just what their services are in general. I hope that's helpful.
That was great. Thank you.
Okay. Great questions. That was
I have just one more. This is sort of on the opposite end of the spectrum from the big picture legal area, but I'm wondering if if folks had heard about doxypep, so the use of doxycycline as post-exposure prophylaxis for chlamydia and gonorrhea and syphilis. And just that feels like within the context of everything that you talked about, Dee, that could be, I don't know, it's not like most clinics are doing it yet, but for folks who are seeking care after, an assault or a questionable encounter where they think they might have been exposed, being able to find a clinic that's doing that, I think could be pretty powerful. So
Ooh, yeah, see, like I'm not a healthcare professional.
it's
So I
like, this
think
is,
like
yeah, this is like brand new. So,
Just worth
nice.
talking
yeah,
about
yeah, I just thought, to bring it up. Again, I don't think it's easy to find providers who are doing it, but I'd be happy to email you. Or if folks in
I would love
general
that.
are interested, we can also send out, the MDH just released like a CDC guide to it. So
I would love more info about that.
yeah, definitely. Oh, and then Christy said that Clinic 555 does
Mm.
DoxyPep. So that's great. And perhaps the Red Door is doing it too. I'm not 100% sure. So, but that's good to know.
Oh, and that's the Ramsey County Clinic. Okay, got it.
Nope, Minneapolis Public Health Clinic, but we are starting, I think, in December. But
Oh,
we
nice.
don't have
great.
it. I don't have a date quite yet, Nikki.
Thanks, Kim. Yeah, awesome. So coming soon. And I guess we do it here. Yeah. So, come on in.
Nice. And so like, and this is where like the collaborations with clinics is so helpful for us because we do work with like a lot of clinics in the cities. And it's so helpful to know like who has who and what's doing. Yeah, that's really helpful. Because that information does spread in the community very
Yeah.
fast. So.
I think the limitation to the DoxyPep right now is going to be like female-bodied people might not qualify at this point just due to lack of research. So
Interesting.
Got you.
Okay. Well, that is something to be, yeah. Ugh.
Yeah, like something that was recent for us is like the clinics really stepped up for monkeypox vaccines for sex workers recently. That was really good to see. So like those connections on things that are really particular to our community, we would love to be included and informed about those things for sure.
And would it be okay to send out your slides with your resources for people? I love the flyer that you included.
Absolutely.
Okay,
And I can
great.
probably even send you an actual flyer PDF too. I can send you a follow-up link in the next like 12 hours.
Great.
I'll get
No
everything together.
rush. Well, thank you. We have just a minute left, or maybe not even, but does anyone have any other final thoughts or questions?
Thank you for your advocacy and your work to reduce the stigma and, all your work. Thank you so much.
Thank you.
Yes, thank you so much, Dee, for the great presentation, and thanks everyone for joining today. We really appreciate it.
Thank you, Lindsay. It was such a pleasure.
Thanks, everyone. Have a good day.